Thank you for watching the video. If untreated, you could lose your voice or be unable to eat delicious food. I will explain pharyngeal cancer. Pharyngeal cancer is a type of cancer that develops in the throat, and people like Waki-san and Tsunku-san have had it. And recently, Yoshi-san from the Yellow Monkey also announced that he had been diagnosed with this pharyngeal cancer. The pharynx is responsible for swallowing food, making sure that food doesn't accidentally enter the airway, and adjusting the vocal cords. So it's a very important part for producing your voice like this. However, pharyngeal cancer is often discovered after it has progressed, and it causes a lot of suffering for many people. Sometimes the initial symptoms have nothing to do with the throat at all. For certain people, the risk can even be 70 times higher. Actually, people who are not good with alcohol have a higher risk. There are actually a lot of things that aren't widely known. For example, you might feel discomfort in your throat, have trouble swallowing, or your voice might get hoarse. And even if you don't have any symptoms, by watching this video you'll learn how to lower your risk of pharyngeal cancer, and even if you do develop it, you'll have a better chance of detecting it early, so please watch until the end. First, in the first part, I'll explain the top 5 early symptoms of pharyngeal cancer, and in the second part, I'll introduce some unexpected things that can increase your risk of pharyngeal cancer. And finally, I'll explain what you can do to prevent pharyngeal cancer before it develops. At YouTube Medical University, we share easy to understand videos from a doctor's perspective to help you become healthier starting today, so I'd be happy if you could subscribe to the channel so you don't miss any new videos. First period, 5 early pharyngeal cancer symptoms you shouldn't ignore. Here's the first one, having difficulty swallowing food. Even if you hear the word pharynx, it's hard to picture exactly where it is in your throat, right? Simply put, as you can see in this image, our throat has an airway called the trachea and a passage for food called the esophagus. Think of the pharynx as the wall that's even further behind the food passage in the back. When we swallow food, we make sure it doesn't accidentally go into the trachea, the airway. By the larynx and pharynx working together in good balance, food doesn't enter the trachea, but instead flows into the esophagus. When you swallow food, this Adam's apple area moves up with a gulp, right? This movement is also very important. If a tumor or cancer develops in the pharynx, it becomes difficult for the throat to move. It becomes hard to swallow food. Because of that, it gets difficult to eat your favorite foods. Your appetite decreases, and as the cancer grows larger, in the worst case, it can press against the trachea in the front, which is the airway, making it difficult to breathe. 5 early symptoms of pharyngeal cancer that are dangerous if overlooked. The second one is this, hoarseness. Have you noticed your voice getting hoarse lately, or has your voice changed? People around you might mention it. If these symptoms persist, you need to be careful. The reason we can produce our voices like this is because the vocal cords, which are folds, open and close to adjust the pitch and volume of our voice. If cancer develops in the pharynx, or if a benign polyp forms, when that movement is obstructed, your voice becomes hoarse. Medically, this is called hoarseness. Of course, I think many of you have experienced a hoarse voice when you catch a cold. In most cases, if your voice becomes hoarse due to a cold or other infection, it will improve within 1 to 2 weeks. If your hoarse voice doesn't get better even after that, there is a possibility of having vocal cord polyps or throat cancer. I strongly recommend that you visit your local ENT clinic or consult your regular doctor. Here are 5 early symptoms of throat cancer that can be dangerous if left untreated. The third one is this, developing a lump in your neck. You might wonder, can a tumor in the throat actually cause a lump in the neck? For those of you who thought that, actually cancer can spread to the lymph nodes. There are many lymph nodes in the neck, and they're in places that are easy to feel. And since they're close to the throat, lumps tend to form in the neck. A characteristic of neck lumps caused by pharyngeal cancer is that the lump keeps getting bigger, and the lump is often hard to move or feels rough and hard. If you notice any of these symptoms, be sure to consider seeing a doctor. Of course, lumps in the neck can also be caused by viral infections like a cold, or bacteria like Streptococcus infecting your throat, which can also cause swelling. Just like I mentioned earlier, lumps in the neck caused by these factors are often painful when pressed, which is a common characteristic. If the cause is an infection, the lump will usually disappear as you recover. However, if it doesn't go away after a week or 2, or if it keeps getting bigger, ear or the number of lumps increases, you should be careful in such cases. 5 dangerous early symptoms of throat cancer that you should never ignore. The fourth one is this: a feeling of fullness in the ear. If you thought a feeling of fullness in the ear means earwax is blocking it, that's not the case. Actually, among throat cancers, there's one called nasopharyngeal cancer, which develops in the upper part of the throat, and it can cause ear symptoms. Many people think the throat and ears are far apart and unrelated, so they ignore these symptoms. However, the ear and throat are actually connected by a tube called the Eustachian tube, so... For example, have you ever tried to pop your ears when you were on an airplane? In this way, the space inside the eardrum and the air are connected, and when there's a difference in air pressure, the Eustachian tube opens to adjust the pressure. However, if cancer blocks the Eustachian tube, you can't adjust the pressure and it will feel like air is trapped, causing fullness or blockage in your ear. You may experience that sensation, and furthermore, because of that, some people may develop otitis media. So, if you keep getting otitis media for some unknown reason, if that's happening to you, there is actually a possibility that pharyngeal cancer is hiding behind those symptoms. Here is the 5th early symptom of pharyngeal cancer that is dangerous if overlooked. It's when you find blood mixed in your phlegm. Have you ever noticed blood when you cough up phlegm? If it only happens occasionally, it might not be a problem, but it could also be an early symptom of pharyngeal cancer. Actually, malignant tumors keep growing larger and larger. Cancer continues to. In order to grow, cancer draws in blood vessels and increases blood flow inside the tumor, causing it to get bigger and bigger. Unlike our normal body, cancer rapidly pulls in a lot of blood flow, so even a small injury can cause it to bleed easily. If you were vomiting a lot of blood, you'd likely go to the hospital, but frequent phlegm with a little blood may not seem as serious. In such cases, you should consider not only throat cancer, but also other diseases like lung cancer or tuberculosis. I recommend that you visit an ENT specialist or your usual doctor at least once. This is the review of the first part so far. As early symptoms of throat cancer that are dangerous if overlooked, you may find it difficult to swallow food. Your voice may become hoarse. You may develop a lump in your neck. You may feel like your ear is blocked, or you may notice blood mixed in your phlegm. I have introduced these kinds of symptoms. However, in fact, throat cancer is also known for being difficult to detect because it often has no early symptoms at all. In the second part, I will briefly explain who is more likely to get throat cancer, its risk factors and prevention methods. Dangerous risk factors for throat cancer. People who fall into this category have a risk 70 times higher. These are people called flushers. What does it mean to be a flusher? Have you ever noticed people whose faces turn red when they drink alcohol? In fact, among Japanese people, it's said that about 40% have faces that turn red when they drink. Drinking alcohol is a well-known risk factor for throat cancer, but actually people who are not good with alcohol and whose faces turn red even after drinking a little have a higher risk of developing throat cancer and even esophageal cancer compared to those who can drink a lot without any change in their complexion. It's said that the difference is as much as 70 times, so you really need to be careful. People who are not good with alcohol actually have a higher risk than those who can drink a lot. Isn't that surprising? So if you or your family members or anyone around you are flushers, people whose faces turn red, please, I would be happy if you could share this video. Now lastly, I'd like to introduce 4 ways to prevent pharyngeal cancer in 3 minutes. Due to the structure of hospitals get reimbursed for diagnosing and treating illnesses. However, I believe that what's even more important is preventing diseases before they occur at the pre-illness stage. However, even if hospitals provide education on preventive medicine, in most cases there is usually no reimbursement, so at YouTube Medical University, from a doctor's perspective, we focus on how you can prevent diseases at the pre-illness stage before you actually get sick, and how you can stay healthy and live a long life. We are sharing a lot of videos, so I would be happy if you could subscribe to the channel if you like. So, here are 4 ways to prevent pharyngeal cancer. The first one is to limit your alcohol consumption. Earlier, I mentioned that people who flush and turn red have a higher risk of pharyngeal cancer, but of course, anyone's risk increases when they drink alcohol. When comparing men who don't drink alcohol to those who do, the risk for men who drink was 1.8 times higher. The the risk starts to increase from drinking alcohol as little as once a week. It is said that, so if possible, you should cut out alcohol completely. However, if it's difficult to quit suddenly, you can create alcohol-free days or reduce drinking from every day to 3 times a week. Gradually cutting back little by little might be more realistic. 4 ways to prevent pharyngeal cancer. The second point is to cut back on smoking. I know it's tough to say, but you should cut back on cigarettes and smoking, because smoking is a well-known risk factor for pharyngeal cancer. This data is also for men, but it's said that people who smoke have a 2.4 times higher risk of throat cancer compared to those who don't. Furthermore, when it comes to throat cancer that develops in the lower part of the throat, the risk from smoking increases to as much as 13 times. So, compared to alcohol, cutting back on smoking may be a more effective way to prevent pharyngeal cancer. Here are 4 ways to prevent pharyngeal cancer, and this is the third point. It's to get regular screenings. When you hear about getting checkups, you might think, I've never heard of screening for pharyngeal cancer. For those people, I recommend a gastroscopy. Gastroscopy is recommended by the government and local municipalities as an organized screening program for stomach cancer, so you can get the test at a low cost using public funds. A gastroscopy involves inserting a camera through your mouth or nose, passing through your throat to examine your esophagus and stomach. Especially with a nasal gastroscopy, since the camera goes in from above, it's much easier to observe the throat. Of course, you can also see the throat with an oral gastroscopy, but when a thick tube is inserted through your mouth and moves around in your throat, it can make you gag and want the procedure to be over quickly. So in that sense, I think a nasal gastroscopy makes it easier to observe the throat. I also perform gastroscopies regularly, and it's not uncommon for me to find a tumor in the throat during a gastroscopy for stomach cancer screening and refer the patient to an ENT specialist. So if possible, please ask to have your throat observed as well when you undergo a gastroscopy. It might be a good idea to mention this to the doctor or nurse performing the examination. Here are 4 ways to prevent pharyngeal cancer, and finally, the 4th point is this. There is a vaccine for human papillomavirus. The human papillomavirus vaccine, or HPV vaccine, is well known as the cervical cancer vaccine. Actually, human papillomavirus is known to increase not only the risk of cervical cancer, but also the risk of oropharyngeal cancer, which is cancer in the middle part of the pharynx. HPV can infect the throat as a sexually transmitted infection, and this increases the risk of pharyngeal cancer. So please consider whether or not to get the HPV vaccine based on your own lifestyle. It might be a good idea to consult with your primary doctor. Of course, this vaccine is available not only for women but also for men. If you want to know more about the HPV vaccine, please check out the video in the description. Now let's review the 3rd period. Here are 4 ways to prevent pharyngeal cancer. Limit your alcohol consumption, avoid smoking, and have your throat checked when you undergo an endoscopy. We also discussed considering the HPV vaccine. Share in the comments if you've experienced these symptoms or have questions about what to do. If a doctor has told you something like this and you felt anxious, I would appreciate it if you could share your experience. And whether you give a thumbs up or a thumbs down, your feedback on this video will help us improve future videos. And above all, I will continue to share easy to understand and enjoyable videos to help you stay healthy. So if you like, please subscribe to the channel. Well then, see you in the next video.